Today we're going to be exploring how doctors can use the ultimate ChatGPT prompt to help diagnose patients. This is a structured prompt that I've developed that guides ChatGPT to act like an assistant. The goal is to make AI-assisted diagnoses safe and effective, but also focusing on patient confidentiality. Remember that ChatGPT is not a doctor and it can't replace your clinical judgment or diagnostic methods. So if you click on the link in the description below, you'll be taken to this ultimate ChatGPT prompt. The prompt itself is made up of several key instructions. They all have a specific purpose. One of them is the red flags. So ChatGPT looks for any red flag symptoms within the case and it outputs this at the end so that you don't miss any critical diagnoses. So now what I want you to do is to go down on the page, and where it says the ultimate ChatGPT prompt to diagnose patients, you copy and paste the below prompt into ChatGPT. And then where it says here is the clinical information, you select Shift Enter twice, and then you get your fake patient notes, or in your case, your real patient notes, and paste that in. And what I'm going to do is turn on the temporary chat function so that this won't appear in my history, the model won't train based on this information, and the memory will be off. The next step is to remove all the patient information. So here is the clinical information, and under that I have the patient information, but it's essential that you remove this. And so you only have the clinical details. I would also advise that if the patient has a rare genetic condition, that you don't input this into ChatGPT, as this could be seen as identifiable information. Another thing that you could do to ensure further confidentiality is to input a fake age. So if the patient's real age is 40, you can input it as 41. And once you're happy that all of your patient identifiable details have been removed, then you send that. Now, in this case, ChatGPT has identified based on my prompt that there is some patient identifiable data detected, and so it can't process this request. So I've actually changed this slightly and just made up some information that is completely different to what I had before. And so I'm going to enter this instead. Now, as you can see, the output doesn't have anything before or afterwards. It initially gives you the top 3 differential diagnoses, so acute appendicitis, and it gives you a brief explanation because it's a classic presentation with right lower quadrant pain, anorexia, low-grade fever, and guarding. And then it gives you 2 other differentials. It gives you the most relevant initial investigation specifically for appendicitis, which is the top differential. And note that the prompt specifically advises on the top differential to be first, and then second, and then the third differential to be third. It gives additional information that we can provide. It gives red flags because there are some red flags in this case. And so what I can do is some additional information. I can say that they are actually male. There is no urinary tract symptoms present. And actually, patient also has a cough. Now, because I've inputted that cough, it's kind of confused things because the patient initially came in with abdominal pain and now I've mentioned a cough. So it said right lower lobe pneumonia. Some general tips and tricks for using ChatGPT is to provide a detailed context. So the more you input into ChatGPT, the better the analysis will be. And I would always advise to slightly muddy up the information. As I said previously, slightly change the age. Obviously, you have to make sure you never input the actual name, hospital number, date of birth, etc. And ask what if, or if there's anything else. So if you're not sure, ask ChatGPT, is there any other information that you specifically want? Another tip is to improve the prompt yourself, have a read of it and see if you want to change the prompt in any way. And finally, I just want to conclude by saying that these are new technologies and you need to be aware of the limitations of them. You need to be aware of the confidentiality, the registration, the license and impact, the legal liability. Remember that the legal liability is still with you as the doctor.